Welcome, everybody, to our special Clearly Aligned podcast. And so I am super excited here to be welcoming not only a fantastic dentist, a phenomenal Instagram creator, is that the right word?
I hope.
But also a really great friend. So I'm
Thank you.
excited to welcome Dr. Sadaf Fazel.
Thank you. Thank you for
I know
having
this is where
me.
everybody in the back claps.
Yeah.
Go team.
Yay!
And so Sadaf and I are joining you guys here from the Invisalign Summit in the Bellagio. And Sadaf actually lectured today, and I'd mentioned this earlier in a previous podcast, that unfortunately Sadaf and I lectured at the exact same time,
I know.
which
Broke my heart.
it's so frustrating. And there's like very few lectures that I'm like, I really want to and need to see. And it was your lecture, Sadaf.
Thank you. Yeah, it was really hard for me to miss that lecture, but unfortunately I couldn't be there. I wish I could have an out-of-body experience and transport myself there, but yeah, it was great. I had a great day today and a little tired because Vegas kind of gets you, and but I'm so excited to be here with Stephen. Stephen's been a great friend, a great mentor, a big inspiration. I've learned a lot from him. I've walked in his footsteps in every way. So yeah, I'm so happy that you have me
Cool.
here.
And yeah, I guess our first inaugural podcast.
Yeah.
There's been so many other firsts. For those who don't know, Sadaf is one of the faculty members at Clearly Select. And so we work fairly closely together, helping design and plan cases and go through clinical protocols for doctors. So she teaches extensively across North America. I would say that Sadaf probably has a busier lecture schedule than I do. And so she knows the inside of an airplane. She knows an Uber. And then beyond that, Sadaf also travels like crazy internationally too for personal trips. So it's kind of like a 50-50. If you're texting Sadaf, is she in Canada or is she somewhere international? And so along with that, one of the things that to me is so cool is that Sadaf has been to so many different courses that we put on through Clearly Aligned that no matter where the location was, I feel like I've seen Sadaf in at least a dozen different cities across North America.
That's true.
So Sadaf, I just want to get some background from you. So tell me about, for those who are listening right now, tell me just about you've told me before, but tell me about the initial journey of your Invisalign path to where you are now.
Yeah. So, I mean, I started out of school just learning about Invisalign and what it is. And it was really exciting to be able to move teeth with plastic. I mean, I would have never thought that would be possible. But then, you start with like easy cases. You would never think you can do moving molars and class 2, class 3 correction. So I did like dabble my way and did a little bit of this and a little bit of that.
You graduated in which year?
2016.
2016.
So I graduated in 2016.
Okay. Yeah.
Got my fundamentals knowledge, like that course that is 3 hours, and I felt like an orthodontist right after and came out. I'm like, I can tackle everything.
I can do anything now.
And then, so I dabbled my way. I took the re-engage course actually to start. So I did a little bit of that and probably did 100 cases like that. And then I started seeing the missing link of like, I want to do more. There's a lot more out there. And then luckily around that same time, and while I was doing other education, so I love learning.
Yeah,
so
Sadaf is the biggest CE junkie I think I've ever met.
No, I mean, you're the exact same. So I was doing COIS and, Chris Coachman, you've done DST. So I was kind of getting a feel for a little bit more advanced training. And then Stephen kind of honestly appeared at the exact same time of that. I was like literally like right before COVID, I think, or maybe start of COVID. I saw a few of his webinars and I was like, whoa, like you can actually move teeth bodily through bone. You don't have to tip them. So then that's when I was like, okay, I want to learn more. And I became obsessed. Like I thought at one point, Stephen thought I'm like this creep girl that's going to all of his courses. Because I'm like,
why is she outside my house again? No.
Exactly, like throwing a stone at your window. But yeah, so I was very obsessed because you opened my eyes to something that I've never thought about. I don't know why, but I never thought I could learn orthodontics from an orthodontist perspective. I think it's so gate kept, and us GPs are left so far behind, and we're being told like this is the only way, this is perfect, and I'm like, it's not looking perfect. Like there's a lot more. So then I seeing what you're doing, and you're being so young, and you're younger than me by like a year and a half, I think.
About a year, yeah.
Yeah, so I was like, whoa, like I need to up my game. Like, Sadaf, you're staying behind. So then I came to all of your courses. I think I took all of them in the first year. And actually one that is so dear to my heart, and I actually spoke a little bit about the stuff that you teach today, was the diagnosis one, because I think diagnosis is so important. And I really believe that as GPs, we didn't learn how to diagnose. As GPs, we have been going right from findings to a treatment plan. That missing piece of like, why does someone have a gummy smile? Why does someone have wear and fracture? We don't do that. We'll just like, okay, you have chipping, you get a night guard, you have chipping, I'm going to fill your teeth. So I really believe in doing diagnosis. And I really think that GPs don't know how much diagnosis matters.
Oh, yeah.
It's
not sexy is the thing, right? Like going out and having a course on whatever it's going to be, like even attachments biomechanics, compared to like we're going to sit down and look at somebody's face and talk about it, is way less attractive for a doctor to be like, yeah, I can stay awake during that. But it's so crucial, because you're right. Like it forms the foundation for how do we put things back then if we don't know where it was supposed to be, how are we ever going to put it back?
Exactly. And like a lot of times, I mean, you probably get the exact same questions as mine. I would have courses where the doctors would approach me and say, patient has a gummy smile, like, what do I do? And I'm like, I don't know. Is it because of the lips? Is it because of the skeleton? Is it because of altered
I need more
eruption?
info so I can figure it out.
Yeah, there's a lot of element to diagnosis that it's missing. And I'm hoping at one point I could be trying to help elevate the education a little bit. And I'm learning every single day. I mean, I as you mentioned, I'm still taking courses as I'm doing courses. I'm finishing COIS hopefully by this January, so I'll be a COIS grad. Woohoo! And and then I'm doing a course in Madrid in October on orthodontics and TADS. So I'm learning, and I like to evolve whatever I'm learning as I'm teaching. So I don't want to just keep it as whatever it is that I'm teaching, because another thing in dentistry is like everything stays a little bit stagnant. Like this is my protocol, and that's it forever.
Totally.
But yeah.
So talk to me about the travel side, because that's something that is really near and dear to me. Like I've always been a travel junkie, I guess. I don't know. I've just loved traveling for forever. And I think that's something that we definitely kind of bond over.
Absolutely.
Do you have a favorite place that you, first of all, just, personal question, I'm not going dentistry, but you have a favorite country, favorite place?
It's a hard question. I mean, I'm from Iran, so I love going to the Middle East. I like, Turkey, Dubai, of course, going to Iran. It's crazy right now, but in a normal world, I would love to go back. That was home for me. But I love Italy. Like Florence is my favorite city in Italy. I feel like
even says Firenze.
I mean, right?
She even knows all the proper terminology.
Yeah, I mean, I love their culture. I think it's very similar to the Persian culture. They're loud. They're blunt. They
tell you like it is. They talk with their hands.
Exactly. So.
Tell me about the different opportunities you've had in these courses then to mix the travel, because you've been to Spain, you've been to Italy with education?
I've been to many. I think I've been to Italy, Spain. We've been to Dubai together. Been to London, all over US. So far these are the places I've been for education. I mean, I'll tell you a story of what actually happened, because I'm always about making what I want happen. Like if something comes to my mind and it's like, Sadaf, you got to do this. It has to happen. I'll make it happen. So I remember when I graduated from dental school, I had one patient who was a pilot, and he came to fix his teeth. And I was just starting as a dentist. So I asked him, like, what have you been up to? And he's like, well, I've been to Norway, and now I'm going to this and that. And I'm like, and I said, oh, I wish, and I remember I said it with such awe, I wish that I could, grab all my stuff and move my dental unit to be able to travel, because I love traveling and I feel like I'm like stuck in this op and I'm going to die in this op. I was like so sad about it. But then I was like, I'm going to have a game plan. I'm going to make this happen. I'm not going to like sit around and just do dentistry, because I love teaching, I love traveling, and I love people. So this is the
natural fit.
It's the best combination of both worlds.
Totally. And one of the things that I think is just so cool, I know we've talked about it before, but it's just the ability to see what's out there in other places.
Absolutely.
You go to something which is amazing like this. You go to Summit and you see top speakers in different areas, but they're North American. So to go to these different conferences, to go to Germany, to go to Spain, to go to Italy, or we were both just in Dubai recently. I was just in Australia, both learning at a course as well as teaching at a course. And so you see the different philosophies of like, this is how the Japanese treat extractions. This is how the Spaniards treat expansion in skeletal cases. This is how Australians treat with different deficiencies. And so utilizing like dental monitoring is pretty much got its infancy in Australia. And so you really start to realize that like we're such a global world
community,
and that there's all these different protocols out there, and you could be doing the best thing possible in North America for whatever, biomechanics, and maybe you're in the 15th percentile in Japan because they know that's so much better than us. And the only way we're going to get better is to truly just go there, learn from them, and then to be, I think, humble enough to say, I don't know everything, and then to take the discomfort on to change protocols, adjust things in practice. And if you can do that, then you'll always be pushing the boundaries to be current and relevant. But if you don't, then eventually you're going to be practicing the best of 1990s dentistry in 2020 or the best of 2020 dentistry in 2050.
Absolutely.
So I have to say, honestly, that Sadaf, when I see what you're doing with the facial integration of Exocad, Smile Architect, it's mind-blowing. So maybe can you talk to what you're doing when it comes to like facial integration? So you've kind of gone over the value of the diagnosis, and we don't need to go into all the details of like these are all the 8 different subtypes of whatever, gummy smile. But talk about how you are utilizing technology in your practice to improve the patient experience and improve your clinical outcomes.
I think for me it's more about streamlining everything. I'll tell you, as a dentist, I struggled in the beginning of my dental school because I'm a very big visionary. I love software, designing, digital. So that was the missing piece in my dental school journey. And I was never like super excited to just work with my hands. I mean, I like it now. I enjoy it because I learned it, but I didn't learn it the easy way. I had struggles learning it.
Yeah.
So when I stumbled upon digital being so efficient in terms of helping me be a better dentist with my designs, with getting my restorations in the right place. I mean, first of all, using orthodontics, as you are a pioneer of it, using the ClinCheck software to be able to plan where the teeth go, and then now use that movement to be able to support the restorations, and then doing it minimally invasive, not having to prep teeth.
Yeah, talk to me about Exocad. How do you use Exocad in your office right now?
So Smile Architect is basically like a mini dummy version of Exocad. Basically, Exocad has a portion that's called Smile Creator. So we have been learning. I mean, I'm still learning, so I'm not super efficient at it.
We all are.
But I'm learning how to do the wax up in the patient's face, add the teeth. You can change even the color. You can change the dimensions, and it's like a free platform to play around with. You can do everything you want basically to these teeth, move them around, add length, do gingivectomies.
It's kind of like ClinCheck for restorative.
Exactly, ClinCheck for restorative, but a lot more. I think it's a lot more advanced than ClinCheck because you could do everything. You can open the bite on the articulator.
And
you can.
In Exocad, then, are you doing Exocad before you're designing anything with the case, or are you first setting up the case and then using Exocad?
If I'm doing, I mean, the right way, I would say, if I was to practice how Kois teaches it, is to do it all in Exocad to start with and then do the ortho after the Exocad. But because of our workflows and how, we have to also be a little productive and practical, I start the plan with a if it is a full mouth case, Kois has a dentofacial analysis sheet. So that is basically taking 5 photos that goes to a lab called Evident. It's a digital lab. And they populate a sheet that tells you like how much are you going to move the teeth, or in what direction you have, like can you extrude or intrude, depending on the proportions of the teeth, depending on the EMA photo, the shush photo, all of these photos that we take for facially generated treatment planning. So you can use that as your guideline for the ClinCheck instead of like doing all Exocad. Right. But then once we're done with the movements, then we go ahead and do
is this now, because in Dubai when we were looking at this, they're integrating in like real-time adjustments that they can change the Exocad, like design the final position of where these teeth would ideally be.
They haven't done it yet.
But
so it is orthodontic. So the ortho module of Exocad hasn't been added on yet, and that would be very exciting when it comes. But
it's still in beta.
It is still, it's still not available, at least to my knowledge.
Yeah, and that's what I think is cool is as these things happen, right, to be able to cut out some of those workflow steps like we're talking about so that you don't need to necessarily send it off for a lot more design of like move the tooth this much and that much with numbers and then have to translate it, but to literally have it integrated into a ClinCheck.
Yes.
Beyond just what Smile Architect is kind of giving us as more of like the overview, this can be like the exact everything with the size, shape, location, color, all of those different components.
Absolutely, yeah. If you could plan your ClinCheck, let's say in Exocad, and have all of those functionalities, I mean, it will just be the best of both worlds. Yeah. And I'm sure it will come very, very soon. But so far, it's a little broken till it gets better.
So still, piecing together platforms.
Yeah.
Yeah, gotcha. Cool. Talk to me about your Instagram. For those of you who don't know, Sadaf is unbelievably funny on her Instagram. She has just like what's your? I'm so bad with Instagram. Is it handle? Is that no? That's Twitter. What's the
followers?
What's the like what do you call the name? Your name on Instagram? Like your handle. What's your handle?
Like the
so Doctor
the ID?
The ID. So doctors can find you.
Okay, Dr Sadaf Fazel is my personal one.
Sadaf
Fazel. So how it started actually was COVID. We wanted to get more patients, and I wasn't doing any marketing. And I'm like, you know what? This is a free platform. We're just going to start posting. People are going to see us. We want to be a fun office where we're not going to be like hurting people or torturing them. And we're a really good team. And when I proposed it to my team, everyone's like, are you kidding me? Like, I'm not going to post a video. So then I was being a goofball, making like all these funny videos.
By yourself?
By myself.
Nobody else
no one would
to be
do
with
it.
you.
They're like, are you crazy? Like, I'm not going to pretend I'm falling on the stairs or whatever. So then I'm like, you know what? I'll do it. So I did a few myself, and then one after another. I feel like my team felt really bad. They're like, this like poor boss of ours is like trying so hard.
She's trying to keep the doors open. She's even like...
Exactly. Like she's just pretending that she's like dying or whatever, and like all these funny stuff. And then also like I posted a lot of educational stuff too. So it's not just the fun aspect, but a whole bunch of things. And then slowly they started trickling in and joining me on this mission. And then in Christmas 2021, it was right before Christmas, actually, we had a video that like somehow went viral, and I never knew what that meant until like I experienced it, like waking up to like 1 million views. And I was like, what the hell happened? And then after that, I think the algorithm just picks you up. And then if you keep doing what you're doing, you'll just start naturally growing. So then, then it became a part of our practice. So it's a part of our culture. It's funny now that we do interviews when we are trying to get hygienists, dental assistants. They're like, you know what? We're good to also participate. And I'm like, it wasn't a requirement.
You're like, we don't need you to, but we'll take it.
I'm like, you know what? If you don't want to. And I have a few staff that don't like to be a part of it. And I'm like, absolutely fine. But most of us are really embraced it as a part of our clinic culture. Yeah. We actually have a lot of fun with it. So
totally.
It's great.
I think it's one of those things to me that's so cool to see how many different ways practices can grow. And the key is, in my opinion, to lean into your strengths and the things you like doing. Like someone, it was Fred Poirier and Stefan Reinhardt. We were just chatting the other day about how they are so funny when they lecture. Mm-hmm. And I just realized, like, I'm not. Like, I'm very, I think, good clinically. I think I do well on the stage. I feel like I keep people's attention, but I'm not going to be able to ever be as funny as someone who just has that natural wit. And so because of that, instead of trying for me to lean into that, like in reality, I mean, Jeff, who's actually here, one of our producers on the podcast, has tried to have me do some different things that might be whatever, silly or different. And in reality, it's not going to necessarily mesh with my style. And so for me, instead, it's more effective to have a podcast or to be on stage lecturing or doing these different things. But I think what's so cool is just to see how you're a naturally funny person. And I think you're a naturally very creative person. And so I guess what I would just say to any of the doctors that are listening to this is you don't necessarily have to be that, I'm going to do a floss dance or something, because that's also not really your style. You're not like, I'm going to go do the floss dance and be ridiculous in that way. You're more of like, actually, I would say is that if I was to do something more on Instagram, it would be exactly what you're doing, which is like smart and funny.
Thank you.
But other people will have success doing floss dances and doing other things that, for as much as you said you were silly or goofy, when you watch these videos, like they're really, really smart. They're really funny. Like one of these videos, I mean, you can never describe it as good as you can just go watch it. But it shows Sadaf and she throws a rock at someone walking down the street. And then the person turns and runs towards her practice angrily. And then she locks the door and turns around to start filming a commercial saying, as you can see, patients are trying to bang down the doors coming to our practice as the person's pounding on the door. Like that is so good. And so I think what the takeaway is that you don't have to necessarily be untrue to who you are as a person to be able to do something that may be pushing you outside your comfort zone still.
I think there's two elements to it. It's first of all, it's being vulnerable and being okay to have some people that might not like your style, because when you put yourself out there and you're throwing a rock at someone, and you're like, running.
It was a completely random. No.
Yeah, like
It was her staff member.
It was one of my team, which it actually hit her. Like
You actually hit her?
I actually hit her, so I think she was actually pissed when she was running. So I'm like, it worked really naturally. But I think what it is first of all, being vulnerable and being okay with being vulnerable in front of a camera. Second one is being authentic to who you are, which you mentioned. Because a lot of times these days, especially with social media and with what's happening out in the world, is everyone's trying to mimic to be like someone they're not, like either being funny or goofy or whatever they trying to aspire to be. And as you mentioned, like I'm not going to be as funny of a speaker as a lot of speakers out there. But as long as I'm authentic and truthful to who I am and embrace the moments of, being goofy and whoever, I could be, then I could bond with the audience either through social media or either through lectures more, because I'm not faking it.
You're authentic.
You're being yourself.
Yeah, and I think you're spot on. Like if somebody tries to do a consult and they're trying to be someone else in their consult, if you're not naturally that person, like you can only fake so much in terms of like how you are. And so lean into the things that are going to make you successful. But I think what you said is right, is you've got to still put yourself into an uncomfortable situation sometimes to say, you know what, maybe this won't always land as I'm thinking it will, or maybe it won't get the 1 million likes. That's got to be crazy, waking up to 1 million likes.
That's crazy. Yeah, it was a great experience. I mean, it's great to see like you're globally, causing people to laugh and joke and comment. It's really interesting because again, I love human connection and the fact that you're like connecting all these people together globally.
Yeah,
it's beautiful.
Totally. So Sadaf, tell me, what are your long-term goals? Like, you dream big. And I know we talk about this all the time because I also am a dreamer, right? What is it that you want to do long-term with your life, with your career?
That's a great question. So
now we're into Sadaf's therapy session.
I know, right? It's like, oh, I'm a broken soul. I think for me is that the reason I've taken so much education is the more education you acquire, the more you realize you don't know anything. I honestly I honestly feel like I don't know anything. Like when I talk to doctors and they ask me questions, I'm like, you know what? I know this and this and that, but I'm sure there's these other things that I don't even know. Like I haven't delved into airway as much. I know a little bit of TMD, but I have an associate in my practice who's working closely with me now, and she loves to learn more on TMD and airway, and she's been going to more courses than I am in that regard. So collaboration of us is really helping. So long story short, like I think that slowly as I take more courses, and at one point I'm sure I'll feel like I got this, because I still don't think like I got it all.
Well, I think you're not giving yourself enough credit, but
it is
it's
hard.
the humility that leads us to continue to push, because
Absolutely.
I agree 100%. I've always said, like, Clearly Aligned is not called like Stephen, whatever, because like I want to make sure that it's about all of the individuals who know so much more than me. Like, you know so much more about facially driven treatment planning and diagnosis, about the integrated comprehensive dentistry. And I want to help grow that. I want to help facilitate that. And just for those who don't know, Sadaf is lecturing with me in Vegas in
Yay.
December.
That'd be fun.
So this is going to be really exciting. So for those who are listening right now, if you want to come check us out, what's the date? December 12th to 14th. So come check us out, Sadaf and I, the Staff and Steven Show. It's so cool to start to get past, like you're seeing with the Instagram, you're seeing with the lecturing, where the interactions we have with patients are always important. They're always valuable. But as you start to see things on a bigger scale of like globally helping out dentists, starting off maybe nationally in Canada, and then it goes to the US, and then it starts expanding, like there are so many people that need so much help that we can provide for them. And knowing that we're both in our mid-30s and probably both have 30 years to go,
Yes.
like it's so cool to think about that journey together, that we will see each other in parallel for our entire careers.
Yes.
Continuously, whether it's Clearly Aligned stuff or Summit things or whatever it's going to be. And there's so much to give back to these doctors who either don't know or just need that extra push and motivation.
Absolutely. I think dentistry can get monotone and boring if you keep doing like class 2s, and I don't know, if you're just doing MODOs here and there, it's not going to be fulfilling for the long run. And then at some point, I mean, I wonder if anyone could correct me if I'm wrong, but I wonder if at some point you just do it because you have to financially sustain your life.
So many doctors say that to me.
Yeah, and I really believe that if you find your passion in dentistry, that is changing patients' lives, either through aligner therapy, either through comprehensive restorative care, because so many people have malocclusion that are being underdiagnosed and are not being treated properly, and we're just band-aiding them and thinking that we're doing the right thing. And that's why this is my passion, because I acquired 2 practices where almost all of the patients were wearing night guards, and they were not bruxing. Like I was just mind blown. I'm like, why are we giving everybody a night guard? Just because, again, going back to not diagnosing patients, we're just not figuring out what's going on with their occlusion. And that what inspires me every day, because occlusion and TMD and all of this is a complex topic. It's not one factor. It's a lot of multifactorial things. So I'm just learning as I go and teaching as I go to be able to expand our, spectrum of care and be able to do better for our population and be better doctors.
Totally. Well, and one thing that I think we've talked about numerous times too is that in terms of doing what you enjoy, it also means sometimes like not doing everything, because you can be good at many things. You can be great at a few things, or you can be amazing at 1 or 2 things. And so I know we had talked about this before, where like being able to start reducing procedures from your life that you don't like in our practice, I hated endo, stopped doing endo within a year. Then I don't really like doing crown and bridge. So for me, that was where I didn't want to do it. But I can help set up and design cases to support that and treat multifactorial. But then beyond that, then we go to, I don't mind doing restorations, but I don't like doing them. So there's other doctors who are really keen to do that. So being able to pass that along. And then eventually for me, I ended up with just surgery, pediatrics, and ortho. They were the only things I was doing. And again, if you find your passion, I think it's 2 things. Find what leads you to have enjoyment. And for some doctors, that is doing everything still. Yeah. But if you know that there's something you don't like doing, I really feel strongly that life is too short to do things. Absolutely. There's a really great book. It is Die with Zero. And so in this Die with Zero book, they interview or discuss a palliative care nurse, where they were saying to this nurse, and I think they studied this, what were the biggest regrets of people who are on their deathbed? And the thought is that people would say, oh, I worked too much. That's not what it was. It wasn't I worked too much. It was, and the second thing was I wish I spent more time with my family.
Yeah.
But the number one thing was that they didn't live a life true to themselves, that they did something for somebody else.
That gave me a goosebump.
It's chilly in here too.
That's exactly what it is though.
Yes.
Because a lot of us just go through the motions and we feel victim to our own lives and we don't understand, like, I'm the one that could be in charge. I can decide right now at this moment that I'm going to change my life. I'm going to only do what I enjoy. And I know it sounds like cheesy and corny, but I swear that's how I've lived. Like, I remember I used to do extractions, and I had one case on a Saturday, and I didn't enjoy that, but it was fine. It was a part of being a general dentist. Yeah. So then I was taking a tooth out, and I got stuck, and it broke, and I could not for the life of me get it out. And it was a Saturday, so no specialist office is open. So I'm trying to find someone, and I look like an idiot calling like all the GPs around me to be like, can you, bail me out? Because there was no one to help me. And my friends, and they were like in Whistler or somewhere else in the world. So I'm like, okay, I'm not going to do it. And I'm like, you know what? My life is too short. Why do I have to sweat on extracting a tooth when it's going to make me feel so...
It's not you.
It's not me. I'm not doing it well. But then I'm doing, I don't know, bonding, or I'm doing aligners or anything, honestly, that I'm good at, and I'm enjoying it, and my patients are happy, and my office is happy, my team is not sweating with me.
And I'm sure you probably have, and this is like in our practice, there's so many doctors who are like, want those extractions so badly.
And exactly that. Like, I now have a amazing associate who comes in. He loves he loves taking wisdom teeth out. He's great at it. Yeah. He's great at it. His schedule is slam dunk booked all the time.
And you don't have to worry about that root tip now anymore.
And I feel like a hero, because all the patients are like, I didn't feel a thing. Yeah. It wasn't a 2-hour, like how I would go out and take out a tooth.
Totally. Yeah.
So it's, because honestly, like, you just got to pick your battles. And I think, again, as general dentists, we feel the pressure that we have to do everything. Like, we have to do the resto and the endo and the ortho and all of it together. But we can do it in-house, bring people on along with you. Totally. Collaborate.
Well, and that's why I bring this up specifically with you as my guest, is because I would say that you, Sadaf, are one of the people in life that I've met who truly, like, is squeezing everything out of it. Like, when I'm seeing that, like, oh, last week you were in London, now you're back, now you're doing this complex restorative, now this is what the Instagram is showing in terms of the case that you just finished up, and then you're speaking down in California, and then you're now in Texas, and then you're coming to one of our courses, and then you're coming to Illuminate. Like, it's just that whole, like, you live a life, I think, that is very true to yourself, because we've talked about this before, your background in psychology, about looking at, like, what causes you to tick and your motivations behind things. And I think that it's very inspiring to see someone who is so driven and focused.
Well,
and I think that's why we relate, because when I first was going to do ortho and learn from all these experts, I said, well, I'm going to do this. And I remember talking to my mom, and she's like, well, why would orthodontists teach you, Stephen? And I said, because I will sleep outside their practices until they do. I will not leave. And I think that's Sadaf too. Like, you literally will go anywhere at any time and pay any amount of money, because you don't ever want to, like, it's not about the money. It's about the fact that you want to live an authentic life to what you are trying to accomplish.
Yes.
And that is worth so much more than the $3,000 for that course, and the red-eye flight, and being tired and needing to chug coffee for the next 3 days, and then whatever else it is. And so I just have to commend you on that, because
thank you. Same here.
I just think you're doing it so well. And so it's inspiring. And the more doctors in our community who live that, whatever it is, maybe it's not traveling for them.
Yeah.
Maybe it is seeing all of their own patients, but whatever it is that leads to someone's, like, authentic life of what makes them happy and brings them fulfillment, that to me is really what I want Clearly Select to be. And so I think it's super cool.
Yeah, I think honestly, one thing I applaud you. I mean, all of that applies to yourself, and you're just being too kind to me. But one thing I applaud you for, and what you've built and what you have, is you didn't make it about you. You made it about people. You made it about your team. You made it about the doctors that are part of your team. It's huge, because in dentistry, we all have all these different doctors that are amazing, but it's like everything is like under their name. And it's like either you're this doctor or that doctor, and then you can't you can be your own doctor. And I always tell other dentists, I'm like, I'm taking all these courses so that I can build and be a Sadaf doctor, for lack of a better word, because I want to be myself.
Totally.
And I think it's just, I think it becomes a lonely world when you have to just segregate and become a part of one community and not be able to be a part of everybody's community. And dentistry is a lonely profession because of that. So what you're building and have been building has been quite, I think it's the first time I've seen in dentistry when someone is really open to collaboration, to not saying that, oh, you're wrong, I'm right, you have to follow me. And it's amazing. So
well,
I applaud you for that. And thanks for doing that.
I think it's just our Canadian nature in a way. Like, yeah, you hear me say it so many times, but if somebody hasn't heard me say it, like, I just really think that philosophy is true. And I try to live by it of, like, learn from everybody. I learned from so many different mentors. I know you have as well. Take what's valuable, ignore what's not. I think there was really interesting. There was a question for one of the speakers today, and he's an amazing speaker. And the question was about a tongue tie, and should you not have cut that tongue tie? And that would allow lifting of the tongue to the palate, and that would have widened the palate, and then the draw wouldn't have been so big. And he was like, oh yeah, no, you go ahead, and like, you could do that if you want. And the question was, she followed up, but like, no, but you need to do that. How did you not do that?
You have to do that.
And it's like, well, no, I actually agree. I think that frenectomy would have been indicated there. But the thing is that there can be someone who's up there on stage who does something amazingly well, but we might look at it and say, you know what, I would actually adjust this just a little bit. I think I would do that too. But I think that it's the infallible, like, oh, well, you're on stage, like, you need to give me a valid reason for why you didn't do X, Y, or Z. And if you don't, then it diminishes what you are showing me. Well, no, it's possible to see our mentors as human and realize that even Rick Litt, who taught me straight wire orthodontics, hated Invisalign, said it didn't work, said it couldn't move roots.
Yeah, absolutely.
Even till the day that I finished talking to him and he unfortunately passed away.
And he's one of the best in facially driven diagnosis.
Exactly, but I can take away his facial diagnosis.
Exactly.
And that is the key thing, is don't look at me or Sadaf or anybody else as being infallible, because we are.
We're humans.
And I think that if we all realize that, then you can realize that somebody else can always teach something that you don't know, and that you're never thinking like, no, I'm right and you're wrong. So
yeah, and that's the problem, because I believe that a lot of people take courses to be like, okay, this is the only way I'm going to follow, and then we go like, laser focus on that one methodology. So anything that is not fitting that box, then it probably is wrong.
Yeah.
But then you're right. Like, a lot of people, I might be doing stuff that I shouldn't be doing, and I might change that.
Well, I wouldn't say shouldn't be even. It's just that's different.
Exactly. Like different philosophy
exactly.
of
It works
care.
in your hands, and it might not work for somebody else. And, but at the end of the day, as long as I think your standards are, you treat the patient
absolutely
to the highest degree possible,
and to the level that your knowledge and your abilities
can handle, and then after that, it's the way that you do it. It can be done so many different ways. So
absolutely, yeah. So I think that's huge, to be able to take different courses and be like, I like this part, but not that part. So I'm going to just take away 20%.
You become a Sadaf dentist, where it's your principles. You're not a Stephen dentist, and I'm not a Tarek Albiali or a Christian Fournier, and we all have our flavors.
Absolutely.
Yeah, exactly.
That's what makes it fun.
Yeah. Well, Sadaf, this was great. We need to do this more often.
Yeah, this was fun.
So again, for those who are listening right now, Sadaf and I will be lecturing together in December. We're also going to be lecturing somewhere. I don't even know. We're lecturing somewhere in the new year for the attachment spine mechanics.
To be in Houston.
I don't know if it's Phoenix. I don't know. I don't know. The team, like, I always joke, but it's true. They literally just told me where to go. So we'll start doing that too, where they'll just be like, Sadaf, here's your plane ticket. Once they've actually even like mailed all my clothes to the hotel. So I just showed up and they're all pressed, ready to go for me.
That probably I can't do. You know how I am. I'm like have my suitcase.
But that is like the pinnacle of like, being able to just show up. Yeah, thank you guys. Much appreciated.
You have an awesome team.
We have an awesome team. So cool. And if anybody wants to know how they can increase their case skills as well as case volume, again, this is what we do with Clearly Aligned and Clearly Select. We are here to support dentists with their journeys, to provide a community where you can learn at whatever level you're at, right? And Sadaf, again, it's cool to seeing, when you first started, you said you'd done 100 cases when you first took Clearly Aligned content?
Yes.
And then now a Diamond provider, Diamond Plus, Diamond?
I've been Diamond,
Okay, don't throw too much pressure in. But Diamond provider, like, amazing, just phenomenal in terms of being able to apply not just the things you've learned here, but from all the different sources around the world. So I think you're a true inspiration to so many different
Thank you.
dentists. And they
You
tell
are
me
too.
that all the time.
Yeah, you are too. Thank
Yeah.
you so much.
Yeah, for sure. Thanks, Sadaf.
Thank you.